Hello everyone. Today I'm going to talk about management of decayed teeth.
What are decayed teeth?
As we all know, the teeth has different layers. The outer layer is the enamel, which is the hardest substance. Then comes the dentin, which is the second layer. The third layer is the pulp, the innermost layer, wherein the nerve and the blood vessels innervate. The bacteria in your mouth attack our sugars or starch substances what you eat, and they release those acids. These acids dissolve our tooth enamel, so that is called as demineralization of your teeth.
What is demineralization and remineralization?
When the acids start dissolving your tooth enamel, it is called as demineralization. That is, they break down minerals in your tooth enamel. So at this stage, it can be reversible. That is, there is potential for mineralization. So it is seen as white chalky spots on your teeth. So if the patients do notice these white chalky spots, if they visit to the dental clinic, then we can suggest some dietary changes for their teeth, and then we can do some fluoride applications like in the form of gels, varnishes, mouthwashes. They tend to remineralize the tooth.
What is a pit and fissure sealant?
And we can also apply pit and fissure sealants. So these are the white plastic coatings on their teeth. They protect the tooth enamel and they stop from further demineralization. So they form a protective layer on your tooth.
How to treat decayed teeth?
If the patients ignore these white chalky spots, and then it spreads to the inner layer of enamel and dentin. So it is seen as little lighter brown to darker brown in color. And the patients may notice mild symptoms like sensitivity to hot and cold. So the treatment of choice are fillings. So in olden days, they used to do gold, silver amalgam fillings, but because of their metallic nature and discoloration, especially with the silver amalgam fillings, it is little reduced in use, and more recently these tooth colored fillings like glass ionomer and composite resins are more in use.
What are inlays and onlays?
If the cavity becomes more wider and these direct fillings prognosis is questionable, then we have to go for indirect fillings like inlays and onlays. These inlays and onlays are of different materials like gold, nickel chrome metal, ceramic or indirect composites. This ceramic and indirect composite is more aesthetic and they mimic the natural tooth structure, unlike the gold and the metal. Because of their metal visibility, we can go for this ceramic or indirect composites, but then they do require 1 or 2 appointments for it to be fabricated, and it is fabricated in the lab and cemented onto the tooth structure. But it is slightly expensive compared to the direct fillings. So if the patients report on time and get their regular visits, then we can perform as minimal treatments as possible without their maximum loss of tooth structure. As we all know, prevention is better than cure. So we can do minimal treatments as possible with their minimal loss of tooth structure. Thank you.